Medicare. Health care for the aged, the disabled, and those with chronic renal disease. Medicaid. Medical assistance for needy Americans of all ages. Clinical Laboratory Improvement Program. Safe and accurate laboratory testing. State Children's Health Insurance Program. Health insurance for millions of uninsured children.
Welcome to CMS You. I'm your host, Dominique Matherin. Each month, we bring you up-to-date information from the Centers for Medicare and Medicaid Services, or CMS. CMS is the federal agency that administers Medicare and oversees Medicaid and children's health insurance programs, as well as numerous other national health-related programs. Preventing disease before it starts is critical to helping people live longer lives. On today's episode, we're focusing on tobacco cessation. Smoking reduces the overall health of people who smoke and the health of those around them. It also causes a number of serious diseases, including cancer, heart disease, stroke, chronic obstructive pulmonary disease, or COPD, as well as complications with pregnancy. For today's discussion, we're very fortunate to have with us Yvette Buckner, representing the Queens Smoke-Free Partnership, and Bobby Hart from Bronx Breathes. Welcome, ladies. Thank you for being with us today.
Thank you. Thank you.
I will start with Bobby. Can you give us a brief history of tobacco control in New York State?
Yes. The tobacco control program began in 2004 after the master settlement, which was the suit that was taken up by the states suing big tobacco. And it came about because they realized that in order to help people quit smoking, the best way to get people to stop smoking is through talking to their doctors. Mm-hmm. So the tobacco cessation centers essentially are training centers. We train clinicians to talk to their patients about quitting smoking.
Very good. So tell me a little bit about how your organization provides technical assistance and training to healthcare providers.
We go into talks with doctors and we get them to say to their patients what is the single most important thing they can do for their health. And that is quit smoking. So the public health guidelines ask that you, with every encounter, the doctor speaks to his patient, asks them if they are smoking, mm-hmm. and if they are identified as smokers, they advise them to quit. And then if they are willing to quit smoking, they give them information on how to quit smoking. They do counseling, talk to them. Mm-hmm. They refer them to the New York State Smokers Quit Line, or they may even prescribe, medications such as gum and patches to help them quit smoking.
Very good. Now, I understand that your organization assists healthcare institutions in the design and implementation of cessation programs and policies, as well as treatment guidelines. So tell me a little bit more about that.
Well, what we've been working on over the years is trying to get organizations to become tobacco-free. Mm-hmm. And becoming tobacco-free is this process. So what we've been doing is sitting down, looking at their current policy to see if they have one in place. Now, most hospitals, matter of fact, all hospitals in New York are tobacco-free campuses where you can't smoke anywhere within the grounds and you have to walk at least 25 feet away from them. So if they don't have those policies in existence, we actually sit down with them to help develop them.
You help develop them. Do you also help in the implementation of those programs?
Not once the policy is set up. We don't help in the implementation, but developing the policy we do. So we actually review with them. We sit down with the administrators to talk to them about why it's important, to be a smoke-free campus, why it's important to have everyone involved, as even with, human resources in terms of if they don't have a policy in place that would help pay for tobacco cessation medications, we help, work with them to develop such policies.
Very good. So do you also work to promote and identify direct cessation services?
Not directly. So people cannot come to my office to get help to quit smoking.
Okay. So how would someone who came to your office looking for that service would they be directed elsewhere?
I usually would direct them to the New York State Smokers Quit Line, where the Smokers Quit Line provide counseling and provide gum and patches, or the New York City Department of Health, where they provide counseling as well, and gum and patches. And, occasionally, depending on what the need is, we may have to give them some gum and patches on the spot, because I do have access to them,
Right.
but that's rare.
Okay. Do you work with any partner organizations to
Absolutely.
bring this about?
We work with the community smoke-free partnerships. There's one in the Bronx, but this is my partner here from Queens, and she works with the community partners. She's the manager.
Oh, very good. So that brings us to you, Yvette. Welcome again, and thank you for being with us today. Can you give me an overall overview of the program that's going on in Queens?
Absolutely. The Queens Smoke-Free Partnership is a part of the New York City Coalition for a Smoke-Free City, which is a program of public health solutions. And we're just another arm of tobacco control. And so essentially, the Queens Smoke-Free Partnership, what we do is we work on 3 major initiatives. And so the first initiative is what we call reducing access to tobacco products for youth. So that essentially is that the tobacco industry is funneling millions and millions of dollars into stores, your local bodegas and convenience stores, pharmacies, and we're working with youth to know that they are being targeted. The tobacco industry wants them to become the next generation of smokers. And so what we do is we work with parents and elected officials and key community groups to get the word out about that so that they know that they can have a voice against big tobacco. We also do outdoor air policies, we do smoke-free housing, and so what we want to do is help people where they live, work, and play to have smoke-free, tobacco-free outdoor environments.
Very good. So talk to us a little bit more about the outdoor space smoke-free policies.
Certainly. So we actually are celebrating 10 years right now. It's New York has always been a leader in tobacco control, and we're celebrating 10 years of being tobacco-free in bars and restaurants. And also, we do a lot of things, and also we work in outdoor spaces such as parks and beaches. So this year, when you go to the beaches with your children and your families, kids can actually go and pick up seashells at the shore instead of cigarette butts. And we're very excited that that policy passed 2 years ago.
That's wonderful. So that is one of our success stories.
That is absolutely a success story. The other success stories that we do is we work with community-based and faith-based organizations to implement voluntary policies. So when kids and seniors come into a YMCA or a Boys and Girls Club, that they're not walking through they're not walking through smoke and being exposed to secondhand smoke.
Very good. So now we've heard about recent possible regulations about condos and apartment complexes going smoke-free. Can you tell me a little bit about that?
Absolutely. We're very excited in Queens, Dominique, because we've had a lot of success in smoke-free housing. Smoke-free housing is a national movement right now, and yet what we're doing in New York has been a little bit behind the curve on this one, so we're excited that it's on the rise. In Queens, we recently acquired 200 units of smoke-free housing. We work with tenants and landlords and property managers to create a tobacco-free indoor space because where people live, that's where they spend the majority of their time. And we always like to tell people that 65% of the air is shared in homes. So what's happening in apartment 1F is happening in apartment, the air is being shared in apartment 3B. So at some point throughout the day, you're sharing that air, and that secondhand smoke is in that exposure to the secondhand smoke for children and seniors is utmost of importance to us.
Very good. So if someone was interested in having their apartment complex or condo become smoke-free, where would they start?
They give us a call. I get calls every day from husbands saying my wife is pregnant, or from parents who say my mother and father are on oxygen and they need our help. So we go out, the Queens Smoke-Free Partnership, we meet with the landlord tenants, we do surveys, we show them sample leases and addendums. It would be like a policy if you wanted to say you don't have a dog or a pet in your home, or lead paint. It's one of those things that we put into a lease or to a bylaws for a condo or co-op, and we work with them through the whole process, doing templates and really helping to amend their leases so that they can live in a tobacco-free environment.
Very good. So how do you engage community partners to build support for these policies and campaigns?
What we have is our foot soldiers on the ground. Queens, as you know, is a community of immigrants, and so we work with community-based organizations such as the Chinese Planning Council, because that's where a high rate of immigrants are, and high rates of smoking. So we work with the Chinese Planning Council and other groups like that on the ground to actually go in, translate information so people understand in their native tongue what it is that the dangers of secondhand smoke and how they can get help.
So can you tell us a little bit about your initiatives in low-income neighborhoods?
Certainly. And I just want to say that low-income New Yorkers actually spend 25% of their income on cigarettes. And that's a huge number to spend on cigarettes. And so we work with community-based organizations to get the word out about tobacco control and about secondhand smoke and about ways to stop. And so we work with our counterpart in Queens, which is called Queens Quits. And so we really try to get the word out, because New York has seen the lowest smoking rates across the country. We're at 14%, as I believe Bobby has mentioned. But there's those pockets, those communities that still have high smoking rates, like Flushing, like Jamaica. And they tend to have children in the homes that it can trigger asthma and other things that you mentioned earlier in the program. So that's how we work with our low-income residents to get the word out through our foot soldiers and through just different programs that we do at the libraries, at the schools, at the places where people go and frequent.
Good. So, I'm sorry.
I just wanted to add in, because of the low income and community health centers, CHCs, focus on, low income. Majority of their patients are on Medicaid. We do a lot of work with the community health centers in developing policies to make sure that their patients are getting the information on how to quit smoking as well.
Very good. So now, we've heard a lot of buzz about smoking and smoking cessation. Would any one of you like to talk about what the city is proposing in terms of any new trends coming on for smoking cessation?
I'll let that to her, because just yesterday we had a big activity.
Yes. So again, I just want to reiterate that the smoking rates are at 14%, which is very low. However, the youth smoking rate has stalled at 8.5% over the past 6 years. And due to that, the proposals that are on the table are all about reducing youth access to tobacco programs. That's the overarching theme. And so the first proposal that's on the table is limiting tobacco displays in stores. The second one that's on the table has to do with price enforcement and limiting coupons and discounts. And the third proposal that's on the table is about the minimum age for purchase for cigarettes.
So that would actually raise the minimum age?
They're looking at raising it, that's correct, from 18 to 21.
Very good. What should anyone do, or where does someone go who has tried to quit and has been unsuccessful?
So that's a
Well,
question.
generally quitting smoking, it's an addiction. So it's very hard to quit smoking. And usually it's been found that people need to have, there can be as many as 7 or 8 attempts before they're able to quit smoking for good.
Wow.
So, we ask people, it's like, don't give up. Don't feel bad. Don't beat yourself up. If you have tried to quit smoking and for whatever reasons were, because you could be stop smoking for many years, and then all of a sudden some crises come up and you find that you start smoking again. So we say, just get back on the horse. Talk to your doctor. Ask them about what would be best. If you tried gum or patches in the past, you may need to try something different, like, lozenges. Or you may want to go completely nicotine-free and go to either, one of the other medications like Chantix or Wellbutrin. These are items that help people quit smoking, and they're very different modalities. Then there's the route of counseling. You could either do singular counseling, one-on-one, or you could do group counseling. And people have found all of these to be very effective.
Very good. So, again, another question that feel free for both of you to answer. I know that we've talked about young smokers. You've talked about outreach in certain communities. Are there any outreach being done in the schools or anything targeted towards particularly young smokers?
Yes.
Yes, there is.
The Queen Smoke-Free Partnership, actually, we're partnering with groups in Queens that are youth-focused, but we also work with the SAPIS program, which is the old Spark, if people know what that means. It's they do preventative services such as drugs and alcohol, and they add tobacco to their list of things that they work on. So we've been in the schools working with Thomas Edison High School in Jamaica, and the Borough Student Council Advisory Group, which is the kids that are the top of the top kids that want to work on and address prevention issues. So they've added tobacco to their portfolio. So we've been getting the word out through them, through the parent coordinators, and really they have become the leaders in this issue, and they are taking hold of it. We're having an event later this month where they're going to speak out in a rally against big tobacco. And we're very excited because this is an annual event that we do, and they'll be speaking out, and they're actually going to wear surgical masks across their face where it says there's several hundred different chemicals that go into a cigarette. So they're going to wear words across their face such as arsenic or rat poison and say that these are the things that go into a cigarette, and we don't want to see this anymore. So that's how the kids are taking a leadership role.
And also in the Bronx, so through our work with community health centers, all the community health centers have school-based programs. So we've been training the health educators, the social workers, and the counselors there on how to talk to youth about quitting smoking.
Very good. Yvette, tell me a little bit about the marketing that's being done out there for smoking cessation.
You know, the tobacco industry can no longer advertise on TV, billboards, or on radio like they used to when I was growing up. So they take all that money and they flood the local convenience stores and pharmacies. And what happens is there's a direct correlation between seeing the ads over and over again, and children have they're twice as likely to recall ads as an adult. So when we go into schools in Jamaica, for instance, I go in and I work with kids, and I'll say to them, what are the colors of a Marlboro pack of cigarettes look like? They can say red and white. What did Newport look like? They can say green and white. And they know how much they cost. That Newport says pleasure on it, for instance. Right. But when I ask them about 3 brands of milk, they couldn't tell me how much that cost or what the colors on that look like.
You know, it's funny you should say that because, you know, when you said Marlboro, I was thinking red and white.
Exactly.
So and
kids remember this. And so the prevalence of these tobacco marketing ads creates kind of a friendly familiarity with them, and that they feel that they're easy to purchase. And so what happens is they count on kids to have that exposure and see it over and over again and think that they're able to purchase cigarettes and initiate smoking. And so I have a story that I could share because my brother actually, he's 35 years old. He's been smoking for the past 21 years.
Wow.
Started when he was 14, seeing these ads over and over again, along with the other societal pressures to smoke. And what I say is to kids is it's unfortunate because he has brand loyalty. He smokes Newports. He started smoking them at 14. He smokes them at 20. He smoked them at 25, 30, and 35. And on average, I mean, if you live in New York City and you're paying anywhere between $10 and $15 a pack of cigarettes a day, the tobacco company is getting about $5,000 from you a year.
Wow.
So they want to take that money, invest it into the stores because they know that the kids are going to see this. They're twice as likely to remember, and the advertising is getting actually lower and lower. So when you walk by with your 4-year-old child, the ads are very low at eye level. And so that's what's happening now. And so we are really working with the community to say that enough is enough. And we have a campaign called We've Seen Enough. And so if you go to our website, newyorksmokefree.org, you can sign on to our campaign to say that we've seen enough and tell the tobacco industry that it's time to stop this in our stores, in our communities.
It's funny you should mention brand loyalty. So it's not necessarily also just tobacco marketing. It's specific brands and people becoming loyal to specific brands.
Absolutely, absolutely. And like I said, the kids can remember it twice as likely to remember it than adults. And so the tobacco industry is banking on this because their current generation of smokers is dying off. So they need a new generation to replace them.
Right. Because I remember tobacco being targeting women, about the Virginia Slims.
Exactly.
A long way.
Exactly. So yeah, they do pleasure and cool and all these different things, and yeah.
And tobacco marketing, which I really shouldn't be talking about targets African Americans and people of color in general by their marketing.
You'll see ads,
Yeah.
you know, when you go, and if you look at ads that are in Jamaica, Flushing, Hollis, they're very different than the ads that are on the upper east side or the upper west side. The communities that they target are low-income, minority, and immigrant communities because that's where they feel their next market is right now. There are other pressures for other people in other neighborhoods, but they do flood those stores. And you'll see, we did a walk with some elected officials called Walk in Our Shoes. It was parents, elected officials, and they didn't and kids, and they didn't realize how much marketing. We did 15 blocks, and on 15 blocks there were 12 stores with anywhere between 6 and 8 ads each.
And low enough for kids
Low enough
to see.
for kids
Eye
to
level
see.
for kids.
Eye level. And eye level is bi-level.
Yes, and I understand you have a personal story.
Well, you know, all of CUNY, City University of New York, their campuses went smoke-free, and in the Bronx we have 3 campuses. And one of the campuses, and we worked with all the campuses to become tobacco-free and develop their policies. So one of the young people who quit smoking through us being there to help them shared her story that, you know, she had been smoking, when we met with her last September, she had just turned, I think, 19. She had been smoking since the age of 13, all right? And she had realized that, you know, her life wasn't her own. She actually said she felt addicted to smoking. So between September and actually November, she was able to quit smoking. And she said to us that she felt that she can walk upstairs without breathing hard. Wow. She felt a lot more, you know, just energetic. And she felt very proud of herself that she was able to do something to take control back over her life, because she really said she did not have control. Mm-hmm. She would get up in the wee hours of the morning if she had no cigarettes to go to the store and buy some cigarettes. And she was just 19.
Right. It's amazing that someone that young would be in such a condition where they've already able to start feeling the physical
effects of smoking. And she did. She was telling me, I'd walk up a flight of stairs and I'd be huffing and puffing. And I'm like, at 19? And she says, at 19. So.
It's unfortunate.
Wow. And now, was she able to report to you anything after that?
Yes, actually, I'm in contact with her on, you know, because this particular college in the Bronx is not too far from us. So I see her every now and then, and she's still smoke-free since September. Well, October, right, really.
Okay, so is there anything else you would like to add or would like to tell the community about your programs or, you know, any type of resources that you would like to mention?
I'd just like to plug our website, which is www.bronxbreathes.org. If you need information on quit smoking or someone to come up to your agency to, you know, talk to someone at your agency about how to talk to your doctors, clinicians about quit smoking, visit our website. And we also refer everyone that we can to New York State Smokers Quit Line, and that was 866-NY-QUITS.
Yes. And I would like to just also say, if you have a neighbor who smokes or you would like to have your home go smoke-free, or if you're a faith-based organization and you want to have your outdoor air policy at your building, go to nycsmokefree.org and /Queens, and we're happy to go anywhere from Astoria to Far Rockaway to Long Island City. We cover the whole borough, and we're more than happy to come and work with these organizations.
Very good. Thank you, ladies. So I'd like to thank our guests, Yvette Buckner and Bobby Hart, for being with us today and providing us with such valuable information, along with their insights on how to quit smoking. Education and community support is a key part in reducing the number of deaths directly related to smoking and exposure to secondhand smoke. Medicare and Medicaid both have programs that cover a wide range of benefits, including counseling, telephone quit lines, and the pharmacotherapy to help beneficiaries quit smoking. For more information on Medicare and Medicaid services available to your community, you can call 1-800-MEDICARE for Medicare services. We are available 24 hours a day and 7 days a week. Or you can check our website, www.medicare.gov. For more information on Medicaid tobacco cessation services that are available in your area, please call your state's Medicaid office or visit their website or you can even visit our website at www.medicaid.gov. Until next time, be well.
Hello, I'm Winnie Chung from the Centers for Medicare and Medicaid Services, and I want to share important information with you about the health insurance and the Asian American community. Here are some important facts. Approximately 15% of all Asian Americans do not have health insurance, and some groups are impacted even more. For Vietnamese Americans, the uninsured rate is almost 20%, and for the Korean Americans, about 25% are uninsured. Asian American health is often impacted by challenges related to language and cultural barriers. Many people do not have access to health care. The Affordable Care Act helps to address these issues. The Centers for Disease Control and Prevention has cited some of the leading causes of illness and death among the Asian Americans, which include heart disease, cancer, stroke, and diabetes, and some other health conditions and risk factors that significantly affect Asian Americans are hepatitis, tuberculosis, HIV/AIDS, and high rates of smoking. The Affordable Care Act, sometimes called healthcare reform, make a big improvement you may not even be aware. Now Asian Americans benefit from improved access to affordable healthcare and high-quality care. Many preventive services such as annual wellness visit, well-child visit, bone mass measurements, mammograms, etc. are now available without cost. That means you can also receive cancer screening and other services that will help you get and stay healthy. And do you know, children cannot be denied health insurance because of a pre-existing condition? And also, young people can now remain on their parents' insurance until the age of 26. And these are already in effect and helping Asian Americans across the country. Health insurance will become easier to purchase for many Americans this year. Health insurance is important to all, no matter where you live or what age you are. And there are many different programs like Medicare and Medicaid that helps Asian Americans to stay healthy. And now there are new options for health insurance made available by the Affordable Care Act. Health insurance allows you to visit a doctor on a regular basis, manage complicated medical conditions like hepatitis, and help prevent future illnesses. And remember, insurance protects you from high costs when illness strikes. No one plans to get sick or hurt, but most people need to see a doctor or visit a hospital at some point. And health insurance helps pay this cost. And this fall, Health Insurance Marketplace will create new choices for purchasing more affordable insurance. It will help you compare the health plans based on the value and will provide answers about the healthcare options. And this new coverage will begin in January 2014. Something else you may not be aware of, the Affordable Care Act also expands the Medicaid coverage and provides more opportunity for Asian Americans. It also provides additional funding for community health centers. In 2016, 2 million Asian Americans who would otherwise be uninsured will gain or be eligible for coverage through Medicaid expansions and through the group health insurance marketplace. Stay informed